Hello, my name is Brett Shelby, and the goal of my presentation this evening is to inform you all of the extensive effects of stress and anxiety on the body, physically and mentally. To start, let me define what long-term anxiety is considered to be. Anxiety disorder is a nervous disorder characterized by a state of excessive uneasiness and apprehension, typically with compulsive behavior or panic attacks, like nail biting is compulsive behavior. In many cases of prolonged anxiety disorder, the body can occasionally go into a panic attack. It's defined as a sudden feeling of acute and disabling anxiety. This is usually caused by a high level of stress over a long period of time, but typically has no immediate cause. During a panic attack, it is entirely common to feel helpless. This is called getting stuck in a panic cycle. While this occurs, you no longer have control over your feelings and thoughts, which instills more panic and more anxiety in a vicious circle. Although panic attacks are similar to anxiety attacks, they are much less common and have few common characteristics like increased heart rate, shortness of breath, and uneasiness. The main difference is that panic attacks are much more drastic and much more sudden, and they use the fight or flight reflex associated with the nervous system, while anxiety is mainly in just the prefrontal cortex. Anxiety and stress are nearly one and the same. It's basically impossible to have anxiety without some form of stress to induce it. In some cases, the majority of individuals' stress can spur from one main factor in their lives. Although this may be somewhat common, this is usually not the type of stress that creates long-term anxiety. That's usually from multiple different things weighing on a person's mind. The buildup of prolonged stress and anxiety has physical and mental effects, and symptoms can be revealed as a result. Spotting physical symptoms in yourself may prove easier than spotting mental and emotional. Physical symptoms include increased heart rate, muscle tension, headaches, chest pain, etc. That also can lower your immune system, which leaves you susceptible for illness. Too much stress can also where the brain and cognitive functions can suffer because of it. Examples of this include forgetfulness, lack of memory, poor judgment, inability to focus, disorganization, and racing thoughts. And this can affect behavior as well, which includes changes in appetite, like not eating too much or not eating enough, procrastinating and avoiding responsibilities, increased use of drugs and alcohol, and nervous behaviors. Stress and anxiety take a heavy toll on an individual's emotional well-being also, which creates problems that make anxiety even worse in many cases. Emotional symptoms include difficulty relaxing, loneliness, depression, moodiness, etc. With overwhelming racing thoughts combined with chest pains, headaches, and other physical symptoms, it's easy to understand why severe anxiety in most cases results in lack of sleep. Losing sleep over time has very real consequences on your body that often have a domino effect to even more emotional instability. Sleep deprivation affects the brain in many ways. One way is it deteriorates hormones like leptin and ghrelin that signal to the body whether you're hungry or full, which impacts one's diet, obviously. It also causes symptoms like moodiness, lack of motivation, irritability, hard to concentrate, many different other things as well. The impacts of anxiety and sleep deprivation can be very significant and even permanent. Not only does it lower your immune system, making it harder to fight infection, but it puts you at risk for new advanced respiratory diseases. It also increases risk of cardiovascular disease and damages hormone protection, including growth hormones and testosterone. There are many medications in the United States prescribed to patients to treat anxiety disorder, including traditional anti-anxiety drugs like benzos, and newer options like SSRI antidepressants. These drugs can provide temporary relief, but also come with some very serious side effects and safety concerns. These medications can be useful in the short term, with some serious side effects, specifically with benzodiazepines. Side effects are drowsiness, dizziness, slurred speech, memory problems, blurred vision, and trouble concentrating. These drugs are also physically addictive and have severe withdrawal symptoms like increased anxiety, insomnia, depression, and seizures that can often be fatal. There are still natural and effective ways to cope with stress and anxiety and potentially alleviate long-term anxiety. therapy, exercise, positive thinking, yoga, meditation, and stuff like that are great ways to relieve tension, frustration, and depression, and can greatly improve your self-image and productivity. It can also help you sleep better and have a better diet. Anxiety in America is a big problem in our mental health system. It's proven to be a weaker part of our healthcare. It's incredibly important to know what causes your stress and anxiety, what anxiety can do to your health, and how you can help yourself reduce anxiety and stress in order to live a carefree, healthy, and happy life.